Welcome everyone. Welcome aboard Julie City once again. As usual, you're highly welcome. My name is Juliet Otuma, a registered nurse and midwife practicing nursing in the UK at the moment. If this is your first time coming onto this channel, you are highly welcome. Now, I'll tell you the only residence requirement. Yeah, that's red subscribe button. Click on it. And the notification icon. That's where you get notification for all my uploads when they come out. Thank you. And if you're a returning subscriber, wow, thank you. I can't thank you enough for that faith you've placed in me. It's a whole lot. Thank you. So today we're going to be looking at the diversity or the flexibility in nursing practice and nursing roles. Yeah, nursing for me, I love it because of this flexibility it gives me. And if you're that one who wants a bit more flexibility, a way to balance work and life, or manage family, trying to juggle family and work if you have young children, or whatever age bracket you are and whatever stage in life you are, yeah, you can always find a place in nursing. So if you need flexibility, you're welcome, and you've made decision to start, or you're about to make decision to start nursing, you are in the right place. Now we'll talk about it. So there are 4 branches in nursing. I'm nurse trained and midwifery, so I'm going to add midwifery as well in case you're that person who desires to become a midwife. So there are 5 aspects. One is midwifery, which is on its own, but they literally work the same way. We have the same governing body, we have similar principles, we have transferable skills, and then you have the 4 branches of nursing, and that will be the adult nursing, the child nursing, the mental health nursing, and the learning disability nursing. Once again, it says the adult nursing, the child nursing, mental health nursing, and the learning disability nursing, then midwifery. For either one, there's a whole lot of flexibility. Mainly, I'm going to take on the adult and the child. So for adult and child, they are basically the same thing. The only difference is the age difference. So if you are adult trained, you have opportunity to work with adults. If you're child trained, you have opportunity to work with children from 16 downwards. So that's it. But the roles, the specialties are all similar because it's the same human body. And then you have the mental health, which looks at people with psychiatric or emotional needs, in like from anxiety, depression, eating disorders, schizophrenia, personality disorder, and so on and so forth. Then you have the learning disability nursing, which is an area that was my first nursing qualification when I started in the Republic of Ireland. In that learning disability or intellectual disability, they are both the same thing, just different countries call it different things. They look after people with learning needs, people with Down syndrome, autism, dyslexia, and all of that. So that's that area. But whichever one it is, there's a whole lot of flexibility. And one secret I will let you know is the fact that for other profession, when you move around, it's like a negative. If you put it on your CV, they look at you like, oh, why are you moving around? Well, what's the reason? Is there anything wrong with you? But for nursing, when you move around this area of specialty, actually it's a plus on your CV. Like for me, I've moved around a lot. I have 3 nursing qualifications plus midwifery, and I've moved around different specialty. And it's a plus because whenever I present my CV, they're like, oh, you must have a whole lot of experience. Yeah, it's a plus for you. So don't be afraid. So we'll go back to the diverse role. So I'm going to say the easy way I used to remember all the words, because there are so many words or areas of specialty in nursing, is the body. So just as we have the various body organs, so are the specialist areas, so are they classified. So we have the hospital-based nursing, and then we have the community-based nursing. In the hospital nursing, it has to do with the bedside nursing. There are other aspects of, you can still work in the hospital without actually necessarily doing a bedside. So for the hospital nursing, it's more acute. Let me use that word. Yes, it's more acute. And then the community-based is more like long term or follow up and all of that. So in the hospital, typically the shift pattern will be say from 7 to 8, depending on your hospital policy and trust policy, and or from 8 to 8 p.m. and then you have the night shifts, which will be from possibly from 8 p.m. to 8 a.m. or 7:30 p.m. to 7 a.m. And then you have midday shifts. So they even have early, late, and there's even one called twilight. So twilight is more like starting about 6 p.m. to 1 a.m. or 7 p.m. to 2 a.m. Like I said, depending on the hospital and the ward as well. So there are a whole lot of options there. So if you think, oh, childcare is an issue for me, oh, I'm a carer, and I'm looking after my mom, or I'm looking after my sibling, and I need a bit of flexibility, I won't be able to do these long days or nights. You have options. There are options for you to choose from. So that's the hospital. And then the wards, the areas of specialty are immense. Like I said, the easy way I used to remember it is the various parts of the body. For some people, you get into nursing, you already have an idea where you are going. Like when I went into nursing, I was like nursing, midwifery. That's the way it was trained in Nigeria, where I was born and bred. So I always had like, do your nursing, do your midwifery. However, I didn't do it that way. Well, I did it that way, but I started with learning disability nursing, and then I went on to do adult nursing, and then ended up doing midwifery. So that's it. Others would actually graduate before they realize, oh, maybe during my training I had favor in this area, or I felt comfortable in this particular area, I would choose it. I felt comfortable when I did my cardiology placement, I found it interesting, I would choose that. Others will be like, I will just go with the flow when I graduate, whatever and however it takes me, and then I'll work out something at the end of the day. Whichever way, that's fine. Nursing has a whole lot to offer, I can assure you that. Looking at the various areas of specialty, or the flexibility in terms of areas of specialty, like I said, if you're looking at the brain or the head, you look at neurology. If you're looking at the eyes, ophthalmology, and that you have ophthalmology ward, you have a neurology ward. If you're looking at the nose, the mouth and the throat, you're looking at ENTT. So you have a ward that specializes in that. If you're looking at the heart, you look at cardiology. So you have a ward that is cardiology. If you're looking at probably the abdomen or the tummy, you look at gastroenterology. Sorry, it's a tongue twister. I'll just put it out there. Read it. If you're looking at, say, female reproductive organ, you're looking at gynecology. If you're looking at urinary tract issues or male reproductive area, you're looking at urology. So there's a whole lot that nursing offers in terms of areas of specialty. Now, each of these areas of specialty, when you go into it, there's opportunity for you to grow and diversify in it. I will use specifically, I worked in orthopedic wards after I graduated as an adult nurse. That was my first area of practice. And you have people, orthopedics has to do with the bone. So either they came in with a fall, they broke their neck or femur or ankle, or was in an accident and had a fracture. Any form of bone fracture at all will be dealt with on the orthopedic ward. That is if you're being admitted. If you're not being admitted, you come into A&E and then you end up in the clinic. Maybe you have a POP and then you come back for dressing and all of that. So in orthopedic wards, the first place of apparently when you graduate will be starting off on the ward as a nurse on the general ward, bedside nursing. And then as you begin to gain experience, there are so many options. So there are a category of people that we tend to see a lot on the orthopedic wards, and that would be like the elderly. Why? Because they have, some of them will have balance issues, especially for those who have dementia or Alzheimer's disease, and they are prone to fall. They are high risk of fall. So when they fall, either break their neck or femur or have a form of fracture or the other. So when they come in, we are looking after them, taking care of their fracture. But then if they are confused, you have to deal with that. So we tend to have a handful of patients on the ward who are confused, and we need to also look after them. Nursing is a holistic care, so you're not just specifically focusing on the wound or the immediate thing. You have to look after the person as a whole, and you have to mind their safety. If they are not safe, they might actually do things that will even further compromise their already compromised situation. So we need champions. So you might end up becoming a dementia champion. Some people will come in and they are coming for orthopedic surgery and they have diabetes. You have to manage it. You can't ignore it. You can't say this is an orthopedic ward, we don't manage diabetes. You have to also manage their diabetes while you look after them. Otherwise, you will have an adverse effect. So you might end up becoming a diabetic champion, or a diabetes champion. So that's an option for you. So a champion basically means that you become interested, you are exposed a bit more who are coming in onto the world, but they have that condition, and you work with a more experienced nurse or somebody that is already a champion, say diabetes for example, and then you gain more experience, you have paperwork that you do, and you get signed off. If you want to take it a notch or a step further, you go in and do a specialist course. So it doesn't mean that you have to leave work. No, you still do your work, you still come to your shift, but you might have one day to go to the uni or the education department to go and do a program or a course particular to that condition, say particular to diabetes as the example we are using, and then you become a diabetes specialist. And when you become that role, other people that will need you or require assistance with managing diabetes, in other words, might actually, you become one of the people that will having input. So if the trust is having a meeting or a program or issues around diabetes, you will be called because you've become a specialist. You've qualified, you've done that course to qualify you. So it's not going to be, don't get scared, it's not going to be like going back to the university to do a 4-year training. No, you keep your job, you do the same work you do, you keep your shift pattern. So if you're doing, say, 3 days a week, you might actually come in 2 days a week. One of the other days you go to university or the education department, do the specialist training, and you might do that for a year or two, and you become a specialist, a trained specialist in that area, but you are still working on the orthopedic ward. So there are so many. There's tissue viability champion, there's NG tube champion, because you might have people who come in, they cannot swallow properly, or they, because of the acute nature of their condition, they are restricted. Even though they are on the orthopedic ward, they need people. So we need people who actually have a bit more knowledge than every other person on the world to look after that. And this applies to every other area. So if you go to cardiology, there are areas of specialty. If you are interested, you start first as a champion, and then you make progress to become a specialist. And if you move to urology, the same thing. If you move to gynae, the same thing. There are so many options. Now, in that hospital as well, if you are the type that like adrenaline rush and all of that, A&E is a different and special ball game for those who love adrenaline. Yes, if you want it hot, yes, or if you don't mind that sharp change from is the keyword quiet to oh my god, it's blowing up everywhere. A&E, medical assessment unit, surgical assessment units, yeah, they are all under A&E, emergency care nursing. That's an area of specialty that you like. Others will think, I don't like the whole concept of having 9-10 patients. I rather love to focus on one patient at a time. ICU might be an area that you like. So ICU literally means intensive care units. So these are people that are really, really ill, as in they are so sick, they need one-on-one observation all the time. It might be somebody that is involved in motor accident, and probably they need intubation, as in they need to help with their breathing, or they need to put them to sleep in order to help them recover, especially if they have brain injury. Then they will need that one-to-one care. So, and depending on how sick they are, and depending on the staffing level as well, but you will typically have 1 to 2 people to look after, as against the ward that where you have 9, 10 or 11 as the case may be. And you just think, no, I don't want to do with the acute. I don't want the whole hospital rush. Then you have the community option as well. So you can become a community nurse or a community midwife. So when you look at the community, you're looking at long-term care. You could be that you're working in a nursing home. So that's not acute. So it's not an immediate danger, but the people, they all need help. You could be working as in being in a clinic in the community. If you're a midwife, you have the antenatal clinic where people, pregnant women come in to have their typical routine antenatal checks and all of that. If you're a nurse, yeah, they have standalone clinics where you can come in. Like if you go to your GP, there's a practice nurse there. They will be able to do all the stuff that they need to do. And if you need to see your GP, they refer you. Or if you need to go to the hospital for something more acute, they refer you. You can also be that community nurse that goes to people's houses to look after them. So there are some people, they don't need to be admitted in the hospital. They're not acutely ill, but they just need to manage their condition. So you might have somebody with diabetes who might not be able to be dependent on insulin. So they are insulin dependent diabetics, and they are not able to do the insulin for themselves, either because of their health reasons or just they are scared of needles. So they will require somebody to be coming in to do it for them, or they might have hands issue like arthritis also, so they're not able to administer those injections on themselves, and they don't have anybody to readily do it for them at home. That's where the community nurse that goes into somebody's house comes in, the home care nurse. So you might go in there and do that for them, and that will be something you'll be doing on a regular basis. It might be somebody as well who is diabetic, but they have foot ulcer. Of course, if you know a bit of diabetes, it comes with a whole lot of complications, and there are some people who are sadly saddled with that complication of foot ulcer, and it requires regular dressing and management. So they will require nurses like you who don't want to do the hospital kind of nursing to come into their houses and help them out with the dressing, because it's a whole lot of tax for them to be going into the hospital. Already the hospital is short-staffed to have those dressings done, so you can be coming in to do that. It ranges on and on. There are so many things you can do as a home care nurse. You might go in to train people to use certain medications, use certain injections. So it's diverse, it's varying, and that's why I tell you, you will find a place to fit. Typically that community nursing will be like 9 to 5, 8 to 3. You will find such. It's just like the regular work style that we all know, not like the hospital where you have the night shifts, the long hours, 12 hours, 13-hour shifts. So yeah, so I can assure you, if you're looking for flexibility, you'll find a lot of it in nursing, and there's areas of diversification as well. Like I said, if you do 6 months in cardiology and you think, no, or you just want to try another thing because you're exposed to some of these areas in your training. So when you're doing your nursing training, you have placements, and these placements expose you to different areas. You won't be able to go around all, but they will expose you as much as possible to the various areas. You get opportunity to pick an area of interest for you and do your placement. Like for me, I did my when I did my elective, I did it on gynae. So I spent my three last months of experience on the gynae ward, because I thought that's an area I would actually love to practice in. Yes. So yeah, the other options are like you can become a theater nurse, so you work in the theater to become a scrub nurse or a recovery nurse. Honestly, it's huge. What I will do is that I'll just put in the description box, I'll link it in the description box in this video, of all the areas of nursing that I have spelled out, so you can go back there and have a clue. Honestly, there's plenty. You can also work in the military, become a military nurse, so you become a full-fledged military personnel. You can work offshore, on the ship, in prisons. Honestly, if nursing is for you, then there's a place for you. Help, like I said earlier on at the beginning, you're thinking of flexibility, or you have a reason why you think, oh God, I really love nursing, but I'm not sure if it's for me. I'm not sure if the timing will suit me. Probably you've had friends who have been working only in the hospital, and you think, oh God, the long shifts are putting me off, or the night shifts are putting me off. Well, you've heard today that you don't just have to do with that. And the fact that even when you're in the hospital and you think, no, hospital is for me, you can still negotiate your hours. So you can negotiate your hours to work around your childcare, if childcare is the issue. Like I identified earlier on, you have twilight nurses. I particularly have a colleague who works only twilights, so she comes in at about 6 and finishes at about 2, so she gets the chance to drop her kids off school, do all the things she needs to do at home, pick up her kids, feed them, get them ready to bed, and then come into work, go back home. She's not staying the full night. She's leaving at 1, so she can go back home, have a good sleep, and come back. And you don't have to do 5 days as well. So there's an option for you. I hope this video has helped ease your mind, or helped you make up your mind on whether nursing is for you. So if you make up your mind to come into nursing, that would be great. That's me. Remember, if you've not subscribed, please click that subscribe button. Don't forget to give me a thumbs up if you like this video. If there are areas you'd like me to discuss or cover, leave your comments in the comment box below, and just give feedback. That's where I also learn, like I said earlier. So thank you very much for listening. Thank you very much for tuning in, and I hope to see you again. Until then, it's bye-bye, and I'll leave you with that quote.